Subscribe now for easy-to-understand health tips. Dr. Madam.
Just imagine, suddenly you have an upset stomach, you keep having to run to the bathroom and your body feels empty and drained. You think maybe you ate something bad and it will pass. Most of the time, it does get better. But if you know what to do and what not to do during this time, you can easily avoid complications. Today, we will talk in very simple language. How to manage sudden loose motion or acute diarrhea at home, when medicine is needed, and when you must see a doctor. This script has been written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other reliable medical sources. Before we begin, a request: to get more simple, science-based, doctor-reviewed health videos, please subscribe to this channel right now. First, at 1 o'clock, a reassuring note. Most causes of acute diarrhea in adults are viral. These usually resolve on their own within 1 to 3 days. Antibiotics are almost never needed. Now let's understand step by step. Replenishing water and salt is the most important step. This part is the most important. The real danger in diarrhea is not the loose stools themselves. The main risk is dehydration, meaning the loss of water from the body. With repeated loose stools, both water and salt are lost from the body. Drinking only water does not replenish this loss. In mild to moderate diarrhea, drink fluids in small amounts but frequently. Second, you can drink watery lentil soup or broth or diluted fruit juice. Third, if you can't drink a lot at once, sip slowly. The best option is ORS, or oral rehydration solution. It contains the right amount of salt and sugar, which the body can absorb quickly. An easy way to make ORS: mix 1 liter or 1 quart of clean water with 1 level teaspoon of salt and 4 tablespoons of sugar. Stir well and drink it little by little. If you notice these symptoms, do not delay. First, feeling extremely thirsty. Second, urinating very little or not at all. Feeling dizzy or faint or vomiting immediately after eating or trying to eat. In such cases, intravenous fluids, IV fluids, may be necessary. Go to the hospital immediately. Over-the-counter medicines. These medicines do not cure the illness, they only reduce the symptoms. Loperamide, also known as Imodium, slows down bowel movements. It helps reduce the number of times you have diarrhea and is useful for mild, watery diarrhea. However, if you have a high fever, or if there is blood in your stool, then do not take this medicine. Bismuth subsalicylate, such as Pepto-Bismol, helps reduce stomach pain and vomiting. It also decreases the amount of diarrhea and has mild antiseptic properties. Even if you have a fever, it is relatively safer. This medicine may cause your stool or tongue to turn black. There is nothing to worry about. If you have bloating or gas problems, taking simethicone together with loperamide can be helpful. Regarding food and daily habits, it used to be said that the stomach should be given complete rest, but now we know that eating light meals helps you recover faster. Once your appetite returns, start eating small amounts at a time. Eat several times over 2 days, not all at once. Good foods include 1 banana, 2 rice, 3 applesauce, 4 toast, 5 boiled potatoes, 6 noodles, and 7 boiled or grilled chicken. Avoid these for a few days. 1. Tea and coffee. 2. Alcohol. 3. Oily and spicy foods. 4. Very sweet drinks. 5. Milk and dairy products. It's very common to have trouble digesting milk after diarrhea. Take any medicine prescribed by your doctor. Here's an important misconception that needs to be cleared up. Not all cases of diarrhea require antibiotics. Antibiotics are only needed in certain specific situations. For example, 1. Diarrhea that occurs during travel. 2. If a bacterial infection is detected in tests. 3. If there is blood in the stool and a very high fever. In these situations, doctors may prescribe azithromycin or ciprofloxacin. Sometimes metronidazole or tinidazole is also used. According to some studies, probiotics can reduce the duration of diarrhea by about a day in some people. However, taking them regularly is not mandatory for everyone. When should you definitely see a doctor? Never ignore these symptoms. 1. If diarrhea lasts more than 12 days. 2. Severe abdominal or anal pain. 3. Blood or mucus in the stool. 4. Fever of 102 degrees Fahrenheit or higher. 5. Not being able to urinate. Dry mouth, feeling extremely weak. 6. Pregnancy, elderly people, or those with chronic illnesses, in these situations, do not try to treat at home. Consulting a doctor is essential. Finally, one last thing. Most cases of acute diarrhea are not something to be afraid of. Timely hydration, light meals, and awareness are key. These three are the main treatments. Your body knows how to heal itself. You just need to support it properly. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information was collected from Mayo Clinic, Cleveland Clinic, and NHS UK, and from other reliable medical sources. If you find this video helpful, please subscribe and share, because good health begins with awareness.